Um, so I'm Lena. I'm a second year MPH epidemiology student. Do you both want to introduce yourselves as well?
Yeah, of course. My name is Victoria Zolfagari, and I'm an EPI student as well. I was an EPI student when I worked on this project.
I'm Pranav Gwalani. I'm an EPI student right now, second year MP student.
So the study that we engaged with was about COVID, and it was entitled the Compass Study. And sort of as an introduction, of course, the COVID pandemic, as we know, has become one of the largest public health emergencies of our modern times. And our study was an observational study conducted by the NIH-funded CoVPN, COVID Prevention Network, across 26 NIH-affiliated sites. And the three of us worked under Yale at the Harlem Prevention Center on 125th Street. So the main aims of the study were to estimate the prevalence of current or prior COVID-19 infection amongst some of the US communities that were hit the hardest by the pandemic. Secondly, to assess knowledge, attitudes, and behaviors regarding COVID, and also provide samples for laboratory assessment. So some aspects of the methods, and we all sort of engaged together on different aspects of these many different efforts. First was electronic consenting of participants with red cup, followed by interview and blood and nasal sample collection. Metadata was used for data collection and interviews, and these interviews collected information about demographics, medical history, and then information about knowledge, attitudes, and behaviors towards COVID, and also information about the experiences of residents during the pandemic. Each participant was compensated $50, and we also conducted QC and QA on the data consistently to ensure that the data was clean and integrity was maintained. And so during these 6 or 7 months, the study collected the perspectives and thoughts and experiences of Harlem neighborhoods and residents in the community all throughout the region. And we focused a lot of our efforts on community venues and outpatient clinics.
Now I can go over the study implementation. So basically, like Lena mentioned, the study was implemented by the CoVPN network. It was conducted by field teams, multiple field teams or single field team at times. Each site team conducted data collection, quality assurance of the data. And the site, all three of us worked with the site teams. We were engaged in community outreach activities. We assisted with recruitment of study participants. We reviewed the eligibility criteria, administered informed consents, and conducted interviews for the study. We also assisted the data manager with data quality check and assurance. We communicated data collection and the trends in the data during the team meetings and our weekly meetings with Yale. We maintained participant compensation records, prevented protocol deviations. We created any data queries. I also, being from medical background, I also assisted with blood collection and nasal swab collection. And overall, it was a team effort that led to a successful data collection.
And then as far as the results go, the data analysis is still currently being conducted at the CoVPN. But the results of those analyses will be really imperative to designing interventions that help respond to certain communities' needs that were particularly hard hit by the pandemic itself. We do have some interesting statistics, though, to share with you all today. So we had 3,920 total participants from sites, and that came from outpatient healthcare facilities providing 500 participants, community surveys with 2,920 participants, with 730 of those being from each age group listed below. And then we also had 500 participants from assisted living and nursing home facilities. So across all study sites, our overall target sample was 58,800 individuals, and we enrolled 26,745. So we reached almost 50% of the target sample size. An exciting statistic is that our site that we are working with, which was the Harlem site, was the second best enrolling site in the nation behind Puerto Rico. And our overall enrollment was 3,177 participants. So we had 81% of the target hits. We would also like to take the time to acknowledge everyone at the ICAP Harlem Prevention Center, Columbia University Mailman School of Public Health, as well as everyone else on the ICAP team, Pranav and Lena, of course, and of course, Yale, our amazing mentor. And we're now open for questions if anyone has any. I'd be happy to answer.
That's great to hear the high enrollment numbers. I'm curious, what were some of the kind of lessons learned or best practices to have such a high enrollment number?
Well, I think one of the biggest things was we were recruiting every day, all day. Nothing stopped us. No weather stopped us. We were out there in the storms, safely, of course. But yeah, we were all really dedicated, and it was a committed team, and we had strong efforts from everyone on that team. And I think that was one of the most influential aspects of getting such a high enrollment target, as well as, you know, a supportive mentor and supportive collaborators, and everyone was really interested and passionate about this topic. But I don't want to speak for Pranav and Lena on that.
Yeah,
I was going to say excellent interns, really.
Thank you.
Go ahead for now. It's fine.
Yeah, I was just gonna acknowledge for that, like a recruitment thing. I also wanted to give a special acknowledgement to one of our special outreach team members, Cece. She was really key in the community outreach part of the the program that led to those high numbers.
Absolutely.
Yeah, it was a really, really challenging study. I don't even think it comes across how challenging this was. We started out on January 27th. It was super, super cold and harsh out there. And then when we ended, it was in the high 90s. The team was sweating. So anyway, we were really working against the elements, but these guys did a great job. And I just wanted to say, that we submitted the results, preliminary results from this work were submitted to CROI, which is the Conference on Retroviruses and Opportunistic Infections, which will be, I can't remember where it is this year, Seattle, maybe? No, I was supposed to be, but it just went online about a week ago. They announced it. But anyway, it's coming up around February 12th or 14th. And anyway, and this was accepted, the overall from all the sites was accepted as an oral presentation. So Jessica Justman, who from ICAP, who's the protocol chair, will be presenting results from this work. I can't share them with you because it's under embargo, but I will share with you after it's presented publicly. So very exciting.
Yeah, it sounds like the team really put in the work, and the streets are not the easiest, as we know. Okay, so next I will turn it over to Frey, but she unfortunately was not able to attend in person, but she sent us a video. So I will be sharing that. So just bear with me. Can y'all hear? No. Okay, hold on a second.
Ports, countries providing
still can't hear.
Service delivery or DSD services.
Okay. Hold on.
We could hear it. It picked up, but can you start from the beginning?
Oh yeah, of course. Great. Okay, so let me.
Sorry, I was trying to unmute quickly.
Yeah.
Hi, my name is Freya Safa.
All good?
And I completed my summer practicum with Dr. Reedy in ICAP's Sequin program. So the Sequin program supports countries providing differentiated service delivery.
Wait, Adalia, it's really fuzzy. I can't read it.
Patients living with HIV. The Sequin program aims to ease the burden on overwhelmed health systems.
Sorry.
It's okay. Can you see it on your screen?
I can see it fine, but let me.
It's super fuzzy, like impossible to make any.
Weird. Okay.
I'm actually very interested.
And these are going to be recorded, so that's why I turned the recording on. So these will be able to be shared out afterwards. But let me redo this again, and hopefully this works.
First time's a charm usually.
Still fuzzy?
My name is Freya Safa, and I completed.
Yeah, we'll just have to listen to her. I think.
With Dr. Reedy in ICAP's Sequin program. So the Sequin program supports countries providing differentiated service delivery, or DSD services for patients living with HIV. The Sequin program aims to ease the burden on overwhelmed health systems through collaboration between network countries on the best practices of DSD services. So continuing the scale up of DSD services requires robust monitoring and evaluation systems. So this practicum project aimed to support that through quality assurance of DSD data. So I helped conduct analyses of de-identified individual level data that explore the feasibility of DSD data collected from programs in Zimbabwe, Uganda, Ivory Coast, and Mozambique, as seen in Table 1. So the main HIV DSD variables that were consistently found across, that were collected across countries and time periods were patient retention, viral load suppression, breakdown of ART coverage, and fidelity of enrollment in DSD programs. So, but in addition to these common variables that data was collected on, that were found across all countries, some countries collected additional information. So some collected information on TB status, on pregnancy or lactating status, quantity of ART dispensed, and the type of facility where DSD services were provided. So all of this is seen in Table 2. So one of the main analyses that I worked on looked like Figure 1, which is a typical modified HIV care cascade done by cohorts. And this one highlights the percent of retained patients with viral load suppression, as well as percent of patients that were enrolled in DSD models who were both retained and virally suppressed. So Figure 2 depicts an example of an analysis of the switch of care models during the duration of DSD enrollment. So ideally, we expect patients to move from high-intensity standard model to one of the low-intensity DSD models, which a large proportion of patients did in this example of Uganda in 2020. So in conclusion, data quality of DSD services can be improved through greater standardization of the type of variables that data is collected on, as well as the criteria used for DSD eligibility, which was not entirely consistent across all countries. So Sequin plans to improve data quality by allowing for data collection through the use of an electronic tablet using Open Data Kit, which should be helpful with that. Yeah, and that is all for me. Thank you for listening.
That was not easy to watch. Maybe it was so busy, it gave me a headache. But it was interesting. I mean, it was interesting. It's unfortunate that we can't.
Yeah. Okay, so I think we're probably closing the breakout groups pretty soon. Any other questions for the participants or presenters? I guess I'm just curious just where everyone is. Is everyone MPH students, or I feel Victoria, you graduated? I'm just curious where everyone is in their studies.
Sarah's on mute.
Oh, go ahead.
No, go ahead, Sarah. It's okay.
Oh, I'm a dual degree student at FIPA. So,
oh, great.
Yeah, I did my first 3 semesters with Mailman, or like the first 2 exclusively at Mailman, the third was both. and now I'm exclusively at SIPA.
Okay, I did a dual degree at social work in SIPA.
Oh, no way.
Yeah, I
That's
graduated
awesome.
in 09. Yeah, so love
Oh,
SIPA, love that school. So great, awesome.
yeah, they're really good at like building community. I think better than mailmen. But yeah, thank you.
So you have another year after this semester, Sarah?
Yeah, I graduate in December.
Oh, in December. Oh, so two more. So this semester and one more.
Yeah.
Right. So 2.5.
And it seems Sarah Rashidi's also a dual degree at SIPA recently accepted. So there's some connections there.
Yeah, email me. I'm happy to answer any questions.
Does she work for ICAP, Sarah? I don't know. What are you talking about?
Sarah in the chat.
Oh, in the chat.
Oh. Maybe her sound doesn't work.
Hi, I'm sorry. I'm trying to attend another meeting with the Career Center as well, so that's why I had my sound off.
Okay, so the breakout will be closing in 2 minutes, and I want to just hear from the other three folks real quick.
Yeah, so I'm a second year MPH student. I'll graduate in May.
Oh, wonderful.
And same with me. Yeah, graduating in May.
Great.
Yeah, and I finished my courses last spring and I did my practicum after that. So now I'm just back for the presentation.
Okay, awesome. Well, all the best with the finishing the semesters and those that still have a year or two left. So all the best and great job. So again, we will be sharing the recordings of the presentations, and I'll make sure that that phrase presentation is shared. Apologies that I had that technical difficulties, but I'll connect with Claire to make sure the next breakout group doesn't have that issue. So
thank you, Idalia, for moderating.
yeah, of course. I love working with students and seeing the great work y'all are doing. So, okay, so now I think another group is going to be joining us.
I think we all need to leave and then we can select another group. Okay, see you guys. Good luck with Esther.
Thank you. Thank you so much.
All the
So
best.
good to see you.
Bye-bye.
And good luck,
Bye.
Victoria, with the job and the move.
Thank you. Yeah, I appreciate it. It's good seeing you.
Okay, bye.
Bye.